My name is Gary Schwartz. I'm Chief of the Hematology and Oncology Service at New-York-Presbyterian, Columbia University School of Medicine. For the last 23 years, I was at Memorial Sloan Kettering Cancer Center in New York, where I led a number of programs, including programs in early drug development, early phase 1 therapeutics, and most recently I've led the program in new development in therapies for patients with melanoma and sarcoma. Columbia York-Presbyterian Hospital presented exceptional opportunities for cancer therapeutics, that we were on the edge of some major discoveries in cancer therapy. And Columbia offered me the opportunity to transform oncology for patients in northern Manhattan, but also with the opportunity to impact on cancer therapy throughout the whole country. The science at Columbia is rich, it's deep, it's unbelievable. It's probably the best in the city of New York, maybe the country. So one of the things that attracted me to Columbia was my ability to actually interact with these scientists to further enrich my own research, to elevate my own program. All my life, I've always trying to enrich myself, to make myself a better person, and to do better cancer care. And part of that is the science of oncology. I also bring to Columbia the ability to now do translational science, where I can take a laboratory concept and move it from the laboratory, from the cell, into the patient, the benchtop to the bedside. And then also discoveries in the patient and move that from the bedside back to the benchtop. This approach in cancer therapy has already led to major new therapies in cancer treatment. And we bring these now to patients at Columbia. So in terms of my own specialty, I'll be working on drug development, trying to develop new therapies for patients at Columbia that will be offering to patients here in this part of the city, but hopefully to patients across the country. And at the same time, I'll be developing programs specifically in the treatment of melanoma and sarcoma, where there have been some major advances in the last 5 to 7 years, having led those programs at another hospital in New York, and I'll bring them to New York-Presbyterian Hospital as well. So if you have patients, or you are a patient with melanoma and sarcoma, and want the best cancer care for your diseases, I will be glad to see you at any given time. I see patients once a week here, and you're welcome to see me and participate in my vision and my program and take advantage of the latest advances in cancer care with compassion, as well as delivering the best advances in cancer possible to you as an individual.